Assalamualaikum and a very good day. Today our group that consists of 5 members, which are Nur AQILAH, NURUL SHAHMARLYANA AMYRA, NURUL ATHIRAH and Nur Fatin AQILAH will be telling you guys about a disease that we are really familiar of, which is COVID-19. Coronavirus disease, or better known as COVID-19, previously known as 2019 novel coronavirus, was first reported in Huanan Seafood Market, Wuhan, China in 2019, or more specific, 31st December 2019. This disease was subsequently spread globally and became the 5th documented pandemic since the 1918 flu pandemic. The virus that caused this deadly disease is severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. The official names COVID-19 and SARS-CoV-2 issued by World Health Organization on 11 February 2020. Outside of China, the first country to get infected with this virus was Thailand, which the first case was reported on 30 January 2020. In Malaysia, the first confirmed case of COVID-19 was detected on 25 January 2020. The case was traced back to 3 Chinese nationals who previously had close contact with an infected person in Singapore. Till 30 June 2022, there are 546 million of confirmed cases and 6.33 million of deaths, with United States as the highest country with confirmed case and deaths. This is the event highlighted from 31st December 2019 to January 2020. On 31st December 2019, the WHO China Country Office was informed of cases of pneumonia under etiology under cause. By 31st December 2019 and 3 January 2020, a total of 44 cases patients with pneumonia of under etiology were reported to WHO by the national authorities in China. During this period, the cause of aging was not identified. On 11 and 12 January 2020, the WHO received further detailed information from the National Health Commission China that the outbreak is associated with exposures in one supermarket in one city. The Chinese authorities identified a new type of coronavirus which was isolated on 7 January 2020. On January 2020, the WHO declared the outbreak a public health emergency of international concern.
As we know, most people get infected with coronavirus at some point in their life, and most of these infections are harmless. The new coronavirus that causes the COVID-19 illness is a notable exception and has caused more than 4 million deaths worldwide. Coronavirus causes significant gastrointestinal disease in humans, poultry, and cattle. The virus that causes COVID-19 is known as SARS-CoV-2, which is a species known as SARS coronavirus or severe acute respiratory syndrome coronavirus, causes a highly contagious respiratory disease in humans that is characterized by symptoms of fever, cough, and muscle ache, often with progressive difficulty breathing. Coronavirus is a type of virus that belongs to the Coronaviridae family and have variants that are enveloped and measure about 120 nanometer in diameter. Coronaviridae is thought to be divided into 2 genera that contains coronavirus and torovirus, which differ in nucleocapsid morphology, with the former being helical and latter tubular. Coronavirus particles are surrounded by a fatty outer layer called an envelope and usually appear spherical as seen under an electron microscope, with the crown or corona of club-shaped glycoprotein spikes on their surface. The nucleocapsid is helical or tubular, composed of a protein shell known as a capsid and containing viral nucleic acids. Lastly, the coronavirus genome is made up of a single strand of positive sense RNA that also known as ribonucleic acid.
Stage 1. Asymptomatic state. Initial 1 to 2 days of infection. SARS-CoV-2, which is breath, most likely attaches to epithelial cells in the nasal cavity and begins multiplying there. The primary receptor for SARS-CoV-2 and SARS-CoV is ACE2. The conducting airway ciliated cells are the main cells infected by SARS-CoV, according to in vitro evidence. The virus spreads locally, but the innate immune response is only moderate. These people are contagious even if their virus burden may be modest. Stage 2. Upper airway and conducting airway response, which is next few days. A more potent innate immune response is induced as the virus spreads and migrates along the conducting airways in the respiratory system. It is possible to anticipate the ensuing clinical course based on the amount of CXCL10 or another innate response cytokine. Beta and lambda interferons are mostly produced by virally infected epithelial cells. In the alveolar type 2 cell, response to both SARS-CoV and influenza. The interferon responsive gene CXCL10 exhibits outstanding signal-to-noise ratio. The sickness will be moderate and primarily confined to the upper and conducting airways for about 80% of the infected patients. Stage 3. Hypoxia, gravitas infiltrates, and progression to ARDS. Unfortunately, roughly 20% of infected patients may develop lung infiltrates and stage 3 disease. and some of these will experience quite severe disease. The fatality rate is first estimated to be around 2%. However, it varies significantly with age. The virus now infects alveolar type 2 cells in the lungs gas exchange units. Peripheral and subpleural alveolar units that are more infected are more common. SARS-CoV spreads inside type 2 cells, releasing a lot of virus particles before the cells go through apoptosis and die. As these released viral particles infect type 2 cells in neighboring units, the end effect is probably a self-replicating pulmonary toxin. A secondary process of epithelial generation will be activated, and suspect lung regions are likely to lose the majority of their type 2 cells. Type 2 cells typically serve as the basis for type 1 cells. In comparison to other types of ARDS, the aberrant wound healing may cause more severe scarring and fibrosis. Strong innate and acquired immune response as well as epithelial regenerations are necessary for recovery.
My name is ALIYAA. We report about the COVID-19 impact to human. It has been investigated that the COVID-19 pandemic has affected overall human life in various ways, and impact is very much strong in many sectors. Apart from the health, it has twisted the routine life into panic and fear all across the world. Second, physical health and lifestyle changes. Lockdown and social distancing norms are forcing people to stay indoors. This can create a negative effect on the physical health and lifestyle, especially people living in urban areas. Sedentary lifestyle, less time spent in sport activities and exercise due to closure of gyms and stadiums. Irregular sleeping time, intake of unbalanced food due to unavailability of certain foods can lead to increased adiposity levels, thus resulting in obesity and other health issues. Lastly, increased screen time activity. With most of the young people working from home, online learning as an alternative to classroom learning, people tend to use screens more often than they normally do, either to attend professional duties or for staying connected with friends and relatives via social media. This can expose people to various hazards like exposure to violent content, cyberbullying, cybercrimes, and phishing attacks. Excessive screen time also poses health harms like brain damage, loss of attention and cognition control, eye strain, and chances to develop myopia.
The Malaysian government implemented the Movement Control Order MCO on 18 March 2020 in order to increase social distancing and slow down the transmission rate of the virus, which was then extended a few times or switched to either the Conditional Movement Control Order CMCO, the Recovery Movement Control Order RMCO, or the Enhanced Movement Control Order EMCO, depending on the country's pandemic situation. The government remains committed to the National Recovery Plan (NRP) enforced on 1st June 2021. Here are some guidelines of Standard Operating Procedure (SOP) that we should adhere to as we ease into our new normal daily lives. First, practice a safe social distance of at least 1 meter from others. Second, regular hand washing with water and soap or use hand sanitizers. Third, wear a face mask, especially in crowded outdoor areas, as a mask reduces the expulsion and transmission of droplets, which is the predominant route of transmission of COVID-19. Fourth, unwell and symptomatic individuals are required to seek early treatment. MY281 is an application developed by the Government of Malaysia to assist in managing the COVID-19 outbreaks in the country. It allows users to perform health self-assessments on themselves and their families. Tan Sri Muhyiddin Yassin volunteered to be the first to receive the vaccine shots to build public confidence in the inoculation process. Also urged the people to register for the vaccination program and get their first as well as the second dose of the COVID-19 vaccine to protect themselves and their loved one from getting COVID-19. Health Minister KHAIRI urged those aged 60 and above to go get their booster shots immediately, adding that they can walk into any vaccination center nearby to protect themselves, their families and the country, especially with the spike in cases related to the Omicron variant. The Ministry of Health, in its effort to counter COVID-19 injection, also set up a provisional hospital in the Agro Exposition Park Sedang, MAEX, in coordination with the National Disaster Management Agency. This hospital is to be used as a quarantine and treatment center for low-risk patients, and 604 beds have been prepared to cater for confirmed cases with or without symptoms of COVID-19.